Hi, everybody. My name is Marie Reynolds, and I will be presenting about the knee ligaments. So on your left, you will see me drawing out three different images of the knee. I did an anterior position of the knee along with the transverse um, position, and then a posterior and a lateral viewpoint of the knee. So over here, you see I drew out the knee, just kind of basic anatomy. And over here, I took out the patella so that you could see more clearly the different ligaments. And right here is the transverse view of the lateral and medial meniscus, along with the posterior and anterior cruciate ligament. So down here is the posterior viewpoint of the knee, and you see that I labeled the posterior cruciate ligament, the anterior cruciate ligament, along with the medial collateral and the lateral collateral ligament. And then you see the lateral and medial menisci. And over here is the lateral view of the knee and all of the ligaments. So here, sorry, saw that question early. So here I gave out the different ligaments and their functions. So the patellar ligament, it assists the quads with knee extension. The medial collateral ligament, it's known as the MCL, but also called the TCL for tibial collateral ligament. It's attached to the medial condyle of the femur, the medial meniscus, and the medial tibia. It resists abduction. And then you have the lateral collateral ligament, the LCL, also known as the FCL for fibular collateral ligament. It's attached to the lateral condyle of the femur and fibular head, but not the lateral meniscus. It resists adduction. Excuse me. The anterior cruciate ligament, also known as the ACL, it prevents anterior displacement of the tibia relative to a fixed femur. It also prevents posterior displacement of the femur relative to a fixed tibia, and it helps prevent hyperextension. The posterior cruciate ligament, the PCL, it prevents posterior displacement of the tibia relative to a fixed femur. It prevents anterior displacement of the femur relative to a fixed tibia, and it helps prevent hyperflexion. And then I added in the medial and lateral menisci. Those are fibrocartilage discs to deepen articular surface and acts as shock absorbers attached to the intercondylar area. Right, and my question for you is, which ligaments are involved in the terrible triad, also known as the O'Donoghue's triad? Thanks for watching.